Hi, I'm Carl Turner reporting for Pixels and Pills from the FDA's meeting on social media and the internet. And with me I have Bard Johnman from Envision Solutions LLC. And he had a very interesting presentation today, and I'm hoping to get him to elaborate a little bit more on what he talked about today. In terms of something you called information sent, could you elaborate a little bit more on what that is and why it's so important?
Yeah, information sent refers to some research that was done back in the 90s looking at how humans interface with computers. And so as part of that research, they looked at how people use links, how they search for information, mainly because looking at content on a screen is tiring for people, and they want to kind of get away from doing that as quickly as possible. So they wanted to look at the differences between how people look for content versus when they're reading through a book versus, on the computer. So this whole concept of information sense, which I think is a brilliant concept, really made it akin to how animals search for information. And humans are not evolved to, search for information online versus being evolved to actually, versus an animal being evolved to hunt for prey. But they use that analogy because they noticed that people tended to look for little bundles of information that are applicable to what they're searching for. So say, for example, you're scanning through a page on Wikipedia and you're specifically looking for information about side effects for a medication. If you see something on the Wikipedia page that says side effects of X medication, that's a strong information set. If you don't quite understand what safety information is or risk information is, for you that's maybe not as strong as an information set, so you're not going to pay attention to that as much because your health literacy or your understanding of that concept may be diminished. So information sense is really something that people use to find information online so that they can quickly scan through a site in order to get the information that they're looking for. So that's where that concept came from.
Okay, great. And in terms of what you were presenting, I noticed that you were presenting a lot of qualitative research, and really almost no one else presented qualitative research. Can you go into what you think the benefit of having qualitative research contribute to what is being looked at in this space? Can you talk a little bit?
Oh, absolutely. I mean, my company, Envision Solutions, has done a lot of quantitative research with randomized populations, and gotten a lot of great statistics looking at how people use information online, how they trust that content. But a lot of that information is fantastic, but it also is more historical in nature. You tend to ask people after the fact what they were looking for, what they, in the social sciences especially, and other disciplines, what you find is by doing qualitative research, asking people what they found, or even just observing them as they do a specific activity, can really illuminate what's happening within, within a particular internet site or during a search or what have you. The real value of doing this type of ethnographic or experiential research for people who are looking at how people use internet technologies really came out recently with a study looking at the class differences between Facebook and MySpace. And what they found is that people on the research tells you that people on Facebook tend to be more affluent. They tend to be more likely to make over $100,000. They tend to live in the cities, that kind of thing. People on MySpace, they tend to make between $40,000 and $80,000. They tend to live in the middle of the country, those types of things. But you don't really understand the real impact of what's happening on Facebook and MySpace until you actually do that ethnographic qualitative research. And when they went into a school, and the school was splitting between Facebook and MySpace. So at the beginning of the year, everybody was on MySpace, and they were using it, and they were talking about how cool it was. But then there was a general shift over to Facebook. And if you only looked at the data, you would only have a partial understanding of what was happening. So what people were saying was, people on MySpace, from the interviews, people on MySpace tend to be ghetto. People on MySpace tend to be poor. People on MySpace tend to be the academic underachievers. If you're on Facebook, that means that you're in the advanced placement class, you're going to go to college, So how could you get that if you did not do, experiential research? Actually go into the field and ask people, why are they doing what they're doing? So in order to really understand how people are using the internet in an intimate way, you need to combine qualitative and quantitative research. If you're not doing both, you're missing 50% of the picture. So hopefully that example gives you a really good sense of why this qualitative research is important.
And in terms of the research that you spoke about today, I noticed that the sample was fairly small, 5 participants. Do you have any plans to make that a broader study and present the information that you get from it to the FDA? And what would be the next steps for that type of research?
Well, the reason why we chose the 5 users is because there's been some research in the user experience field that shows that testing 5 users gives you a sense of the big issues associated with a website, or in this case a search. So that's why 5 tended to be a good number. As you start to get past, to 10 to 15, you tend to start getting the same information again and again. So the benefits of doing more research of this type after 5 tends to diminish. With regard to doing additional research, I think one of the things that people are very interested in is this issue of understanding of risk information or safety information. Those scrolling advertisements, those banner advertisements, I talked about banner blindness. Can we do additional research to understand what types of banner advertisements tend to be more ignored versus other ones? And this is critically important for the FDA, because if they don't understand that banner advertisements with scrolling risk information is not that effective for people, then they're relying on that to provide safety information. That's again, you're missing half of the point. So from a public health perspective, exposure to information does not mean that someone consumed it. So we need more information and to do more studies around that. So I think that we may do some additional research with some more sophisticated techniques in the future to look more closely at this question of what's effective, what's not, what are people looking at versus what they aren't, and those types of things.
Great insights. Thanks so much, Fard.